For staying with us, we now tell you that the National Drug Law Enforcement Agency says 15 drug kingpins of 3,412 offenders that were successfully prosecuted and convicted in 2023 bagged 168 years of imprisonment collectively. NDLEA Chairman, retired Brigadier General Mohammed Buba Marwa, made this known on Wednesday while addressing commanders, officers, and men of the agency during an awards and commendation ceremony. He also explained that to create awareness about the dangers of substance abuse, the NDLEA intensified its war against drug abuse advocacy nationwide. Marwa assured that it will not relent in its efforts to improve the welfare of the NDLEA workforce, but warned that the agency will be firm on disciplinary issues.
It is needless to say that 2023 was a good year in terms of our collective performance. According to our statistics, we recorded 13,664 arrests, leading to the seizure of 1,606,800 kilograms of assorted illicit drugs and 3,412 convictions, with a total of 5,570 offenders charged to court in 2023. It is indeed a year that at least 15 drug barons bagged 168 years of imprisonment collectively. That is a substantial improvement over our performance in 2022. Notably, in 2023, we also ramped up our enforcement action against cannabis farms and carried out at least 7 successful major operations, leading to the discovery and destruction of over 206 hectares of cannabis plantations. Similarly, our war against drug abuse undertaking, that is WADA, across the country was on the up in the period.
We now take it to West Africa, where Mali has reaffirmed its exit without delay from West African bloc ECOWAS. Mali said it was not bound by the organization's one-year time frame for withdrawal. Bamako's military government announced its withdrawal from ECOWAS on January 28, along with neighboring Burkina Faso and Niger. But Article 91 of the bloc's treaty stipulates that member countries remain bound by their obligations for a period of 1 year after notifying their withdrawal. The letter said ECOWAS rendered the treaty inoperative when it failed to meet its obligations by closing member states' borders with Mali in 2022, denying it access to the sea. In the meantime, the ECOWAS Parliament has called on the military governments in Mali, Niger, and Burkina Faso to reconsider recent decisions made to withdraw their membership from the regional bloc. The Speaker of the ECOWAS Parliament made this known as he declared open the last session of the 5th legislature of the Parliament, currently holding in Freetown, Sierra Leone. Amadine Uyi reports.
The 5th legislature of the ECOWAS Parliament commenced on March the 9th, 2020, with 115 members from 15 states of the regional bloc. With the region undergoing tremendous challenges, many believe the Parliament has played a significant role in addressing many of them.
The ECOWAS Parliament reflects the face of democratic representation in the region and continues to champion the values of the rule of law, human rights, good governance, and accountability, all built upon the achievements of the preceding legislatures.
As regional lawmakers converged on Freetown, Sierra Leone, for its last extraordinary session of the 5th legislature, the meetings first commenced with a seminar for parliamentarians where they reviewed the menace of illegal mining and its consequences on member states.
The problem with the unregulated mining that causes also a reduction in the government revenue streams is not only because of lack of finance and access to market, but it's also lack of relevant information, geological data that they could use.
we should be forward-thinking. Government should take it a lot more serious. One, protect that environment. Be present at every point, especially where these resources are available. Make provisions for in-country value addition.
At the end of the seminar, the extraordinary session finally commenced. The Speaker of the Parliament expressed regret over the Parliament's inability to achieve one of its core goals, an election into membership of the regional lawmaking body. He says this will improve parliamentary operations, deliberations, and oversight duties.
We are of the opinion that this election, by direct universal suffrage, will confer strong democratic legitimacy on the ECOWAS Parliament and further strengthens its representation functions. The Fifth Legislature has therefore undertaken to initiate reflection on the modalities of this election and to advocate, raise awareness, and mobilize in favor of this cause.
He also expressed regret at the decision of Mali, Niger, and Burkina Faso to withdraw their membership from the regional bloc, urging them to reconsider their actions and respect the ongoing mediation process aimed at resolving the current impasse.
We have noted with grave concern recent developments across the sub-region, notably the quest of Mali, Niger, and Burkina Faso to withdraw from ECOWAS, and the unfolding political developments in Senegal. We have been in close contact with the President of the ECOWAS Commission and are exploring every possibility for Parliament's swift intervention. Meanwhile, I wish to call on all political actors in these member states to respect the democratic process, allow the mediation process to continue, and demonstrate respect for the rule of law.
With the Fifth Legislature now winding up, residents of the bloc will be looking forward to the inauguration of the Sixth Parliament. In Abuja for News Central, I am Amadine Uyi.
Let's also tell you that the number of sexual predators on the internet who blackmail victims using their nude pictures and other means has been on the rise lately across the world and in Nigeria as well. To address this growing online menace and help protect unsuspecting victims while also helping them seek justice, a media parley has been organized for journalists in Nigeria, Lagos State to be precise. The parley is about how victims can now seek redress. News Central's Bernard Akede tells us more in this report.
He removed his WhatsApp DP and put one of my nude pictures as his WhatsApp DP on his display picture on WhatsApp. So I saw it and I started crying.
Cases of online gender-based violence have been on the rise in recent times, and more often than not, the victims do not get the desired justice, while perpetrators sometimes get off unpunished. In some cases, victims who have been bullied or blackmailed online have had to quit the internet use entirely, while others have even attempted suicide. While total control of internet may not be easily achieved at the moment, some groups have been able to create platforms where victims can go online, register cases of online sexual harassment or blackmail as it affects them, and get free help ranging from counseling to legal support, amongst others.
We saw that what was happening offline in terms of gender-based violence was having a manifestation online. There was an online manifestation of what was happening offline. There was a surge during the pandemic, just like there was a surge in physical aspects of gender-based violence. And there was a lot of awareness and response to physical aspects of gender-based violence, but online dimensions are completely ignored. And so we needed to fill that gap. Somebody needed to start talking about why online gender-based violence is a manifestation of real harm, the way in which victims are experiencing the harms, and what can be done to strengthen protection for them.
Nigeria's tech space has recently witnessed astronomical growth, which in turn has caught the attention of several organizations, and many now believe the growth of tech can do more than just benefit the country in financial and economic terms.
We're partnering with Tech Society to ensure that we've seen recently that image-based attack revenge pornography, things like that, have been a deterrent for people coming on board on the internet because they're afraid. Their pornographic images can be used against them, can be used against them in ways that they may never recover from it. So we are developing this tool in partnership with Tech Society, for example, to ensure that Nigerians who are on the internet space and on this great World Internet Safe Day have access to such tools and can take advantage of it.
The 6th of February every year is set aside as Safer Internet Day, and this group believes that ridding Nigeria's cyberspace of sexual predators and apprehending offenders will require the right collaboration, hence the involvement of journalists.
Ground zero for us is a digital world where women and girls, children are safe. They are able to navigate without fear, without harassment. We are reducing digital inequalities. Everyone can participate online, participate in the digital economy, have access to the opportunities that are provided by digital technologies without fear of harassment and while keeping their dignity and their safety intact.
If the fight against digital abuse is to be taken seriously, the commitment towards building a safer and more inclusive digital world must be seen as the responsibility of all. In Lagos for News Central, I'm Bernard Akede.
We understand that mobile internet access has been restored in Senegal's capital, Dakar, 2 days after authorities cut access as the country grapples with its worst political crisis in decades. Access to mobile data had been blocked since early Monday, with the Telecommunications Ministry citing the dissemination of hateful and subversive messages on social media. Lawmakers on the same day voted to delay this month's presidential poll until December 15, extending the term of outgoing President Macky Sall. And now in Central Africa, conflict between M23 rebels and government forces is intensifying in eastern DR Congo's Masisi territory after days of unrest that have left dozens injured. Tensions in Masisi have displaced residents of many villages and overwhelmed health centers. Residents pointed to Sake, a strategic point on the road to provincial capital Goma, as a flashpoint in the latest fighting in North Kivu province in the east of the country. Army spokesman General Sylvain Ekenge told reporters there had been intense fighting for control of a stretch of highway running between Sake and Minova, a small town in the neighboring province of South Kivu.
Leo tunalamuka busubuhi, bombe zinaanza angukia mkartie. Tunaenda jikuta sasa wote tutaishia pale. A partir ya pale ndio sasa tunajisaidia kufika hapa Mwisa kwa Kumugulu. A partir ya Sake masasi kuna lilia kule kumulima yulu kutrua antenne vraiment tunasikia masasi na kwa mingi ndio vile tumejitosha. Tunalomba gouvernement tusaidie na sisi turudie kwetu. Juu tumekuwa Kumugulu tujikute hapa.
Bakongomani tunateseka, tuletie njoo amani. Tunakimbia watoto wetu washateseka. Hatuna kwa kuenda. Tunaacha bitu na watoto washapotea na watoto wanakufa wa mingi. Ambia Kisekete atupatie njoo usalama.
Watu wanakufa kiolela, watu wanagongea mu mabarabara juu ya kukimbia. Sasa tunakosa kama tufanye aye. Ona watu wewe banayala humu Mugunga, na wewe walikuwa Sake, wote wamekimbia. Sasa sie wote hapa na wametutia tena katikati. Sake banatai kamata. Sasa tutakimbilia wapi? Obe banapenda twende Malaki vero mwezi tumalize.
Let's now head to the continent's north, where an Egyptian court has handed a prison term to opposition politician Ahmed Al-Tantawi, who had hoped to run against President Abdel Fattah al-Sisi last year. Al-Tantawi, who withdrew his candidacy before the December vote, citing harassment and obstruction, was found guilty of election campaign irregularities. He was handed a one-year jail term that could be suspended on bail of about $647. The opposition politician was also barred from running in parliamentary elections for 5 years in the ruling by the Mataria Misdemeanor Court. The opposition politician had accused authorities of hampering his efforts to collect endorsements required to run under various pretexts, including computer malfunctions. And now to the Rainbow Nation, Andrewsville, a serene village nestled amidst the picturesque landscapes of the northern Cape province. This village is quiet, yet there is an atmosphere of dissatisfaction among its residents. The Central's Bongani Seyi was at this village and spoke to its residents. Here's the report.
In the heart of Northern Cape Province lies a forgotten community, the Khoi and the San people. Many of them believe they have been neglected by the government, left to fend for themselves without basic necessities and opportunities. Here, there are no basic amenities, no thriving economy, and very few employment opportunities. Water is scarce, clinics and shopping centers are far away, and the education system struggles.
There are no resources at all. So there is absolutely nothing that is here. So what else can you do? So it kind of feels like these are the people who just fell from hell or fell from heaven, if that's the case, and they were forgotten. And they are forgotten. They are just being dropped here, and that's that. They will see for themselves. So my take is that this is a heartbreaking situation, and most of them are not working. If maybe 98% of them are not working.
Meet Peter Cooper, a 35-year-old Adrisville resident. He lives in this shack with his mother, sister, wife, and kid. For Peter and his family, life is terrible since they wake up every day not knowing whether they'll be fed.
Dit is tekort werkloosheid en onze watertekort en ligte. Het ons hier is donker op Andrieswil en ons paai is ook reg. En die huise. Ons huise is ook in 'n goeie toestand.
Without jobs, many of the young generation find solace in alcohol. It leads to a vicious cycle of poverty and despair. Young girls, too, often find themselves with unintended consequences.
The situation with those kids really broke my heart. So young, so beautiful. And then you begin to ask yourself, what's going to happen to these kids, after school? What's going to happen is that they will finish school, come back to the community, get drunk, and have babies. So I think this is an opportunity for the government to really, really, really come back into this and start developing this community in many ways.
Margarita Bro, 59, has lived in this area since 2005 and says she is concerned about the youth's future because the government has neglected them.
Terwyl ek so werk met hierdie kinders, sien ek daar baie uitdagings. As 'n ouma, 'n moeder van kinders wat 10 kinders grootmaak, wat met ander vrouens as 'n kinders werk. Daar sommige kere waar ek so hartseer word, as ek praat met die kinders oor gesinne, families, gesels ek met hulle en onderwyl ek soms kere met kinders praat, ondervind ek dat daar dikwels probleme is in die huishoudelike.
The resilient Khoi and San people are determined to overcome these challenges, but they cannot do it alone. They call upon the government to listen, respond, and take meaningful action. They want their aspirations lifted and create a brighter future for the generations to come. Another Khoisan's greatest challenge is race. Land restitution was intended to benefit Black South Africans. However, the Khoisans are not generally considered Black and are classified as colored. And the issue of land has long been unresolved. Despite these challenges, the Khoi and San people have found solace in continuing to love one another and celebrate ancestry through festivals, cultural gatherings where they assemble and remind one another of their cultural heritage. They hope one day the government will finally listen and provide them with the support they desperately need. In the Northern Cape, for News Central, Bongani Sisiba.
In a groundbreaking move to enhance healthcare access to for cancer patients, the National Coordinator of the Cancer Control Program at the Federal Ministry of Health, Uche Umoku, has revealed plans to incorporate cancer treatment into the National Health Insurance Scheme. Speaking at the Nigerian Army Officers' Wives Association, NAOWA, Cancer Awareness Summit in Abuja, Umoku emphasized the government's commitment to providing adequate and affordable healthcare services to citizens battling cancer. This initiative aims to ensure accessible and affordable healthcare services for citizens diagnosed with cancer. The government has also introduced the Cancer Health Fund, which has already registered over 2,445 patients and funded treatment for more than 750 individuals. At this point, joining me on the news to discuss this is the co-founder and chief operating officer on Kopadi Technology Limited, Dr. Adara Engi. Dr. Engi, it's nice to have you in our studios.
Thank you for having me.
So what do you see as the biggest barriers right now for cancer patients in Nigeria? We'll talk about affordability, accessibility, and the quality of the treatment.
So for Nigerian cancer patients, what you must know is that Nigerian cancer patients face a lot of barriers, and you can structure this into three. There's the financial barrier, there's the infrastructural barrier, and then, of course, there's the shortage of specialized physicians or specialists in cancer care. But more importantly is the financial barrier. Cancer treatment or cancer care is financially toxic. I'll give you a bit of context. The average cost of cancer treatment in Nigeria currently, it's around 7 million in government or public hospitals, and in private hospitals can be as high as 10 million naira. And you're looking at cancer care from, the time of diagnosis, all of the diagnostic workup that it entails, to surgery, to chemotherapy and radiotherapy. And so all of this always, that financial toxicity always pushes a lot of our patients into poverty. I mean, how many people have 7 million or 10 million, lying around just waiting for cancer to take a toll on your family, and you spend that much? So it is financially draining, it's financially toxic, and a lot of patients, because they have to pay out of pocket. Now, National Health Insurance Scheme currently does not cover or capture any form of cancer treatment, and this is important to note. But luckily, the government is making important steps. By one of it was the launch of the National Catastrophic Health Fund, which is the Cancer Healthcare Fund that is helping a lot of indigent patients to sort of access care, specifically in the government-owned hospitals. That's the tertiary-owned hospital. And I think this is already evident and having a place in National Hospital Abuja. But we still need more patients, to get on board that system. Currently in Nigeria, we see over 125,000 new cancer cases. And so with just only about less than 3,000 patients being enrolled onto that scheme, there's still a huge burden, and we can do more.
Okay, let's take a bit of a closer look at this. How prepared is the current cancer care infrastructure and workforce in Nigeria when it comes to handling the likely increase in diagnosed cases that we might see once treatment becomes more affordable?
So unfortunately, just as cancer is financially toxic, there's also a shortage in terms of our infrastructural support and in terms of our human resources. For one is that in Nigeria, currently, we have less than 90 clinical oncologists. And these 90 clinical oncologists, sadly, are only available in 18 out of 36 states in Nigeria. So meaning that 18 states in Nigeria currently do not have a clinical oncologist. An example would be Ogun State, that doesn't have a clinical oncologist but sees a high volume of cancer patients. And so you can imagine the number of patients that have to travel from these states that don't have, a cancer specialist down to Lagos or Abuja or University of or UBTH or ABU Zaria. They have to go to these areas where they can get, cancer treatment. It's also sad to know that currently in Nigeria, we only have 13 radiotherapy centers that are functional. That is 13 centers that either have a linear accelerator or a brachytherapy machine. And so what that means is that, and out of those 13, radiotherapy centers, 9 are government-owned, and luckily 4 are about private-owned. But even with those 13, a lot of them experience a lot of downtime, right, in these centers. And so what happens is that there's a huge burden. We can't meet up with the current demand. If we are saying that we have 125,000 new cancer cases every year, with just 9 machines, less than 90 clinical oncologists, very limited oncology nurses, there's that huge burden in terms of human resource and even infrastructurally. So currently we are unable to meet the demand. And so this is a clarion call, you know, to stakeholders, to a lot of the government officials. More money, investment needs to go into cancer care to sort of strengthen, you know, our already depleted or limited infrastructure.
We see these shortages, and of course, you've made appeals now to government. So beyond making treatment more affordable via the NHIS and this call or appeal that you are making, are there policies that you think can be brought on board that can significantly impact or improve the quality of health care for cancer patients in the country?
Well, yes, so there are a lot of policies we can begin to implement. For one is, a lot of my patients that I see, in fact, a good number, 60% of my cancer patients that I see present late, and more than 70% of these patients will die. And so there's this clarion call that firstly, we need to invest in cancer awareness and early detection. So prevention, ensuring that there are a lot of screening, awareness programs, campaigns, outreaches out there that can actually support a lot of early detection and making sure that these patients come in when they are still in, you know, the early stages that can be treated. Secondly, will be there is a need for the government and a lot of funding to be pumped into local research to support all of our indigenous researchers. There's a lot of research that needs to be done, you know, especially with how cancer treatment can be tailored particularly to the African or to the Nigerian patient. And so there's a need for funding and a need for funding to support all of these local researchers. I think thirdly, we'll be also supporting innovative solutions. One of those innovative solutions will be things like our telemedicine platform, and Oncopadi offers this. Telemedicine platform would allow us to get to those, you know, far to reach areas, those underserved communities, those communities where there are no cancer specialists, where there are no clinical oncologists, that can still offer, you know, second opinion treatment, diagnosis on such patients, that can still offer some form of care and support a multidisciplinary treatment. Fourthly would be, there's also that call to invest in the residency program, right, in the training of these specialists. So we need to give more incentive to get a lot more people into cancer residency program. So getting more people into cancer residency program. And lastly, of course, will be, we need to build more cancer centers. 13 cancer centers is just too small to meet our current demand.
All right, thank you so much, Dr. Dora Enye, for educating us at this time.
You're welcome.
And that's all at this hour. Before we go, let's take a look at some of our top stories. Nigerian Senate postpones security briefing by service chiefs. Internet restored in Senegal amid protest over election delay. Dozens injured as fighting intensifies in DR Congo's eastern Masisi. Don't forget to send your eyewitness report to the WhatsApp number and email on your screen. And you can follow us on social media. We are at New Central TV. You can also watch New Central live on DSTV channel 422, Star Times channel 274, Avo TV and YouTube. Many thanks for watching. I am Lekon Onobanjo.